What's going on, y'all? This is Zach, Living Corporate. I hope that your MLK Day weekend was restful and restorative and reflective. I know for me, I spent most of the weekend really just hanging out with Emery and Candace, and then thinking a lot about the legacy of Dr. King and the work that he did, and frankly, how hated he was in his time. You know, it's easy to forget that Gallup polls had him trending at almost like 75% disapproval from the majority of white Americans because of his stances on the economy, on race, and on the Vietnam War. And when you think about the fact that the FBI deemed him a terrorist, that he was being, monitored and watched at all parts and points of the day, that he was being slandered and maligned in the media, frankly, that the same type of graphics and things that we see about Black Lives Matter and Colin Kaepernick and things of that nature were very, very similar to Dr. King and the way that he was treated and spoken about. You think about the fact that, frankly, all of Black civil rights heroes, there's not one Black civil rights leader that you can name that was not seen as a terrorist in their day, as an enemy of the state. All of them were. And it makes you then question, okay, so then if you're in a role of diversity, equity, and inclusion, you're really trying to fight for those same ideals and principles. If you're not making the majority uncomfortable, you're probably not doing the work that you think you're doing, or that you at least claim that you're doing. I'm seeing more and more folks make posts about the fact that the Capitol is a wake-up call. We have a long ways to go. Let me tell you something. If the Capitol insurrection is your only signal, or your main signal that we have, quote unquote, a long ways to go, you have disqualified yourself from being in this DEI space. Okay. We've had several instances, points of evidence over the last several decades, but certainly over the last 4 years, that we continue to come towards a very, very, very harsh collision. And I'm frankly anxious about that, because I don't see these things letting up. And frankly, I don't see these things letting up because I've yet to see a collective understanding and call to true education on the depths and challenges of white supremacy, right? We're really, really good and adept at creating a lot of noise when the big things happen, quote unquote, the big things, but not necessarily at recognizing patterns and behaviors that create these big things, right? Like, there's an environment that had to fester for this to happen. And I need some of you to do your learning in private. It's insulting to the Black and brown folks that you claim your work is for to write this content. And I don't know if you're really writing it for the Black and brown people you're trying to serve, or if you're just trying to write it for your other like white constituents so they can pat you on the back. Y'all are kind of having like your own little groupthink situation. But for the Black professionals in general, and certainly the Black and brown professionals in the DEI space, your words are insulting, and your lack of growth and maturity and awareness in this season is exhausting. So just a point of advice and feedback from one DEI professional to you listening to this: do your learning in private. If this was a wake-up call for you, then you have a long way to go, to use your language back to you. And you need to do that. You need to learn those things outside of posting on LinkedIn and on Twitter and using it to like make yourself look better. It's really gross. So stop. With all that being said, I'm really excited about the guest that we're going to have today, Dr. Brian Williams. Dr. Brian Williams is a friend of the show. Thankful that he was able to make the time to come on. We actually had this conversation yesterday on MLK Day. We talked a little bit about just how he's been doing, how busy he's been, his podcast, his book that's coming out. And then we really circled back as a veteran. We talked about his perspective on the insurrection at the Capitol, and we talked a good bit about COVID-19. So look, I don't want to give all the sauce away. I'm giving you kind of like an overview, but I don't want to give no more, okay? Before we get into that interview with Dr. Brian Williams, we're going to tap in with Tristan. See you soon.
What's going on, Living Corporate? It's Tristan, and I want to thank you for tapping back in with me as I provide some tips and advice for professionals. This week, let's discuss the top 5 jobs in demand for 2021. Over the last year, we've seen the pandemic decimate whole industries and spark the need for candidates in new and expanding ones. This can be a confusing time for many job seekers trying to figure out where to focus their energy. LinkedIn News senior editor Andrew Seaman did some research and analysis to find out which jobs are currently in demand, and I wanted to take some time to discuss the top 5. First are professionals on the front line of e-commerce. During quarantine, there was an increased need for people who help get products to the stores and into the customers' hands. According to LinkedIn, hiring for roles like driver, supply chain associate, package handler, and personal shopper grew 73% year over year. The second is loan and mortgage experts. Interest rates have been historically low. In combination with the Paycheck Protection Program, this has led to a 59% increase in hiring for roles like underwriter, mortgage loan officer, escrow officer, and loan closer. The third is healthcare support staff. Not only did the pandemic increase the need for doctors and nurses, but it also increased the need for people who support those healthcare professionals, such as healthcare assistants, pharmacy technicians, dental assistants, and home health aides. Hiring for these type of roles has increased by 34% since 2019. The fourth is business development and sales professionals. While some jobs were lost due to the uncertain economy, others were added that could help the bottom line, including roles like sales consultant, sales operations assistant, inbound sales specialist, and strategic advisors. Hiring for these type of positions increased by 45% from 2019 to 2020. The fifth is experts in workplace diversity. We know the uprisings last spring caused companies, large and small, to reassess their commitment to diversity, equity, and inclusion. This has led to a 90% increase in hiring for roles such as diversity manager, diversity officer, head of diversity, and diversity coordinator. LinkedIn's list includes a total of the top 15 jobs on the rise right now. Make sure to check out the link in the show notes to see the other 10 they listed. Whether you are looking to get back into the workforce or want to invest your talents in a new area, hopefully this data helps you find an available path in confusing times. Thanks for tapping back in with me today. Don't forget, I'm now taking submissions from you all on career questions, issues, concerns, or advice you think may help others. So make sure to submit yours at bit.ly/tapintristan. That's bit.ly/tapintristan. This tip was brought to you by Tristan of Layfield Resume Consulting. Check us out on Instagram, Twitter, and Facebook at Layfield Resume, or connect with me, Tristan Layfield, on LinkedIn.
Dr. Williams, welcome to the show. Glad to have you back. It's good to hear from you.
Zach, I appreciate the invitation to come back. I really enjoy your show and following it, and I want to commend you on the work that you're doing to keep this discussion moving on so many different fronts. So keep it up, brother.
Well, I appreciate it. And also happy MLK Day to you.
Same to you. It's quite a time we are in, right? His message is still resonating decades after his assassination. And it's more important nowadays than ever, it seems.
And to that end, let's get right into it. How did you feel as you were, getting the news and you're seeing all this stuff going on in the media about the insurrection at the Capitol?
Yeah, January 6th, I had a complexity of emotions about that entire event. And it was more difficult because I was actually working that day when this was going on. So I didn't get a chance to stop and sit in front of the television and watch this unfold real time. I got bits and pieces as it occurred. But anger was part of that. Embarrassment for our country that this is happening. Disgust with our leadership that allowed this to happen. And concern knowing that doesn't just end right then, right? That could have been much worse. And we know that this will probably continue at least for the foreseeable future. We don't know what is going to happen next. So I couldn't pin down just one emotion. It's just looking at that going, wow, I disbelief, anger, sadness, embarrassment. Like, how did it come to this in America? And I know how, but still, the reality of seeing it unfold with that sort of violence at our nation's capital is still somewhat difficult to grasp.
Yeah, and I know that you've come on in the past, and we've talked a little bit about your journey and your work, your community work to create safer communities by building coalitions with the police. I'm curious about when you talk about the complexity of emotions, considering your story and the work that you've done and the work that you continue to lead. Is how did you feel when you saw reports and video of police coordinating with the insurrectionists and retired police and active duty police and military folks being engaged in the actual insurrection acts themselves?
I was not surprised by that, but I also need to add that I'm a military veteran myself. My dad is a career military veteran, 23 years. So I grew up watching my father put on his uniform every day and go to work in service of this country. I myself chose to follow in his footsteps and do the same thing. So I have this respect for what it means to make sacrifices to serve a greater good and a greater cause, especially knowing that in this country, those aren't always reciprocated to Black folks, right? We know that. There's no doubt about that. So it is not a binary thing for me. There's a lot of nuance in all of this for me. And with my work that I've done with police over the past 4 or 5 years, there's no doubt that sort of white supremacist element exists within law enforcement. If we understand the history of law enforcement in this country, we cannot ignore that. And the problem is we like a lot of people still don't talk truthfully about that history. So to see those images and to know the reports that are coming out, no surprise at all. And what I hope is that people that continue to deny that or ignore it, step up and say, like, we need to really do some work to eliminate hate, intolerance, white supremacy in all of our institutions. And when Black people benefit in this country, everyone benefits. It's not a zero-sum game, as if you have to give up something to benefit of someone else. And those are the ideals, those are the professed ideals of this country. That's the oath which I swore to serve, and I believe that's possible. We have a ways to go. It's not going to be an easy road.
And as we think about like a long way to go, and we talk about just like different treatment, right? So, you're looking on the news and you're seeing, people continue to play or say that, make the state, which is true, right? So I'm not trying to be impatient about it, but it's like, okay, yes, we know this is like, if Black Lives Matter were to have stormed the Capitol in that way, we know it would have been like a massacre. We see even in like, there's been now videos coming out about, the FBI arresting the folks who were participating in the insurrection and then saying, hey, look, you'll be out by lunch. It's okay. Don't worry about it. We got you. We see the judges letting folks go, like not letting them go on bail, right? Giving them a lot of leeway and grace to roam the streets, even though they are actively looking to overthrow the government. That inequality and just difference and inequity in treatment, I think it continues as we think about this COVID vaccine. First of all, before we get into like the distribution of the vaccine and some of the reports that are coming out around that, as you compare populations in terms of who's receiving the vaccine, I want to talk a little bit about like Black Americans' reluctance to actually take the vaccine in general. Um, do you think that we in our public discourse are talking enough about the reasons why Black Americans are so reluctant to take the vaccine in terms of like the history of health inequities and mistreatment, malpractice, and abuse? Do you think we're effectively discussing the topic?
As far as the reluctance among Black Americans and the inequalities that we're seeing with COVID-19, there is abysmal lack of education about the history that led us to the point we are now. There's lack of education in just on our public schools, lack of education within the medical community where I work. And So no, we are not talking about it. And I've actually put together a course that I'll be teaching at the Harris School of Public Policy at the University of Chicago starting this spring that will walk students through this, right? And I'm also writing a book right now that's going to talk about this. I want to add something to this educational discussion. And before we get back on that, Zach, I hope you don't mind. I need to go back to this issue about the police and the insurrection and what you mentioned about people being released early.
Yeah.
That, we can use soft terms about how that's unequal treatment and the inequalities, but or to be strong, like that is the manifestation of white supremacy, systemic racism, the hypocrisy of the criminal justice system, right? But it's not that it's something we cannot fix if we are honest about what that is. Like, we know that if that was a Black Lives Matter protest, that would have been ended up much differently. There would have been more dead bodies. We know that people would not be getting out of jail so easily right now. We know that the way it would have been presented in the press, in the media, would have been much harsher. And, I'm actually surprised to hear that we talk about them as being treasonous and traitors and insurrectionists and using a lot of tougher terms about what they did and what they represented than has been done in the past. So from a criminal justice standpoint, that's being laid to bear as well as and how we treat these people who went armed to the teeth with plans to kill, kidnap our elected officials in the nation's capital with an attempt to overthrow the government. Like, we cannot minimize what that means. Now, pivoting back to healthcare, which you asked about as far as
yes, thank you.
COVID. I had to get it off my chest, Zach. I'm sorry, I had to get it off of my chest.
No, it's fair. So, and this is the thing. To your point around you being a military veteran, there's something to be said about that. I have a couple of friends, and of course, I have family members, like most Black folks do, who are military veterans, and many of them, it strikes a different chord for them. Like the actions on that day, it just strikes a very uniquely infuriating and just like painful chord. So I know I appreciate that.
Right. Now, as far as the COVID disparities, and we're talking about reluctance within the Black community to get the vaccine, there is a long history of exploitation of Black people by the medical establishment for experimentation. We may know about Tuskegee is one of the most famous examples of that sort of exploitation. That's really just a tip of the iceberg of what else has gone on. Just one example is the doctor that's known as the father of modern gynecology. He developed perfected some of the most widely used surgical procedures for women with vaginal surgical issues. But he did this on enslaved women without anesthetic, against their will. So we're talking about women that are being held down to have their genitals mutilated. So this individual can perfect this technique, which you would later do on white women with anesthesia. Right? And he's there were statues around the country of him until recently that were taken down. That's one example. Recently, up until the 80s, Zach, they were still forcefully sterilizing young Black women to prevent them from having children. It's been known as the Mississippi appendectomy. That's a colloquial term for it. But women are being sterilized without their knowledge or against their will up until the 80s. So that's in my lifetime. And these are just two examples beyond Tuskegee of how Blacks have been exploited, or Black people have been exploited for medical exploitation. So when you come out and say, okay, there's this disease that's been killing Black people at a rate that's higher than their population percentage. Now we have this vaccine that was seemingly developed overnight that we're going to get to everybody. Is it too much to believe that, you know what, I'm not so sure that what you're doing is in my best interest? Because we've heard this story before. So it is completely understandable that there's reluctance. And what that means is that the messaging and the education has to be specific to the patient populations that we're trying to save. And if we look at this through the lens of health equity and racial equity, then we recognize that how we message, who we message, when we message must be unique. And we must put a focus on vulnerable patient populations who do not have ready access to healthcare, who do make up the bulk or essential workers force, who are put in harm's way every single day, who may not have the money or the transportation to get to the vaccination sites. There's a whole spectrum of issues that we need to consider, and that takes leadership from the very top to make that happen.
I want to shout out the Black Stocks because they've been tweeting a lot and just talking a lot about, inequities in healthcare and the impact of COVID-19 on communities and race. And I'm trying to get your perspective on why these reports continue out around the fact that, despite the fact that COVID-19 continues to kill Black and Brown communities disproportionate to white communities, there still seems to be a delay, or like they still seem to be receiving the vaccine at lower rates. Is that can't be all because of reluctance from Black and Brown communities? Like, what are the other factors that are causing the communities hit hardest by COVID-19 to have the vaccine distributed at least to them?
Oh, yeah, that is absolutely true. I'm glad you said that. It'll be a mistake to blame Black and Brown communities for their own demise, right? For their own lack of vaccination. There's reports coming out right now across the country of communities where if you look at the maps of who has the highest infection rates and who has the highest death rates from COVID, and then look at the maps of who's getting the vaccinations first, the wealthy neighborhoods are getting vaccinated first, while the less wealthy neighborhoods, which are primarily Black and Brown communities, are the ones that are not getting vaccinated and the ones that are still dying. So right there is a graphic representation of how wealth equals health, right? If you live in the wealthy zip codes, you have the access, you probably have a primary care physician, you probably have a car, can drive to a site. If there's not a site near you, you can drive somewhere further away, where there are other, what people call social determinants of health, which is what I call structural determinants of health, because this is a manifestation of structural racism that make it more challenging to get the vaccine. So it's not just reluctance to get the vaccine. That's just one part of it. There are also all these other issues that make it more difficult to get the vaccine, where there's lack of PCP, lack of ready access to a facility, lack of a vaccine site being put somewhere near where you live. All these things add up, which is why leadership must look at this through the lens of health equity, racial equity, and recognize that we have these historically marginalized and segregated neighborhoods that are also suffering the greatest infections and death from COVID. Therefore, we must make an effort to get the medication off the shelves into their arms, is one. But also we, and I include myself in that as a medical professional, have to prove that, look, not only should you trust us, but we are trustworthy. We are here to ensure that you get healthy, but also if you do get sick, we will not abandon you. So it's a matter of being trustworthy as well.
Dr. Williams, I know that you've taken the time, and I appreciate you being on the show. Before we let you go, would you like to talk a little bit about the book that you're working on and any other project that you're excited about in 2021?
Yeah, there's two projects that I'm very excited about. First is this course I've developed to teach at the Harris School of Public Policy at the University of Chicago, which will essentially look at race, violence, and medicine, which is what I talk a lot about. But it will be a course taught through the lens of a trauma surgeon myself, using my experience at some of the busiest trauma centers in the country. And I specifically designed it to speak to non-healthcare students. So these are grad students that are pursuing public policy degrees. And I did this because these issues that you and I discussed today, they're huge issues that have a lot of intersecting parts, and it is beyond the realm of us in healthcare to solve those. So I want to inspire a generation of non-healthcare professionals to think about how can they be a part of these solutions for health inequality, gun violence, racial inequity in healthcare. What can they do with their expertise? So that starts in the spring. And I'm looking forward to that. My second big project, I've been working on this book, which is a memoir called Race, Violence, and Medicine. And polishing my proposal right now. My literary agent has pretty high standards, which I enjoy and I respect. So we're working on that, and soon we'll be sending it out to editors and publishing houses to see if someone wants to work with me to get the manuscript in its final polished form. So hopefully that'll be published next year sometime. The publishing timeline is not fast. I don't know if you've published a book ever, Zach, but it's not a fast process.
I haven't, but I did field some offers last year, and it's a while, right? So they were like, "Look, you submitted by the spring, it'll be ready by next fall." I was like, "Ooh, okay."
But I'm gonna keep people up. Go to my website, brianwilliamsmd.com. I'm gonna keep people updated there about how things are progressing with the process, and I'll keep my podcast going as I can. It's been a little bit sporadic now because of work and other things, but I'm delayed, but I'm not off the air for good.
I hear you. I mean, between all the work that you're doing in your community, as well as having conversations and driving education around COVID-19 vaccine, and I mean, your hands are super full. Look, Dr. Williams, can't thank you enough for being on the show. Definitely consider you a friend of. So you're a friend of mine, but you're also a friend of Living Corporate. I look forward to having you back as that book gets closer to publish. Hit us up. You know where to find us. We're gonna make sure we got you. We take care of you. Okay.
All right, Zach. I'm happy to come back anytime. You stay safe, stay healthy, my friend.
All right, y'all. Look, that's Living Corporate. Look, I'm so thankful, so glad that you're still rocking with us. I pray that your 2021 is off to a good start. I know we've had plenty of distractions, chaos, heartbreak, and loss already. But, I'm hopeful that this year will be better than our last. And listen, there's plenty of ways to support us, right? The first way you can support us is just by telling a friend about us, telling your coworker, telling your supervisor, telling a family member, letting people know that we're out here, right? Take the little share button on whatever player you're using, press the little share button, and then it's going to be like, share options. And then just, press text or share it to your social medias, you know what I mean? Share it to your Black Planet, your Mahente, your Zanga, whatever you got going on. Share it over to your TikTok it. I don't know. Listen, I know I'm feeling old because I'm not a big TikToker. I know what TikTok is, but I'm not, you know what I mean? But share it where you share it is my point. Another way you can help us is by giving us 5 stars on Apple Podcasts. Give us 5 stars and give us a review. It's a great way to let people know that we're out here, that we exist. And look, I'm telling you, you are helping the podcast and helping Living Corporate as an entire network more ways than you know by just giving us those 5 stars in review. Until next time, this has been Zach. Catch y'all later. Love y'all. Peace.
Living Corporate is a podcast by Living Corporate LLC. Our logo was designed by David Dawkins. Our theme music was produced by Ken Brown. Additional music production by Antoine Franklin for Musical Elevation. Post-production is handled by Jeremy Jackson. Got a topic suggestion? Email us at livingcorporatepodcast@gmail.com. You can find us online on Twitter, Facebook, Instagram, and living-corporate.com. Thanks for listening. Stay tuned.